I just wanted to say again, good morning, everyone. Sorry about that, but thank you for joining us today. My name is Jackie Grimes, and I am the Vice President of Marketing and Communications here at United Way of Metro Chicago. Our conversation this morning is the third virtual discussion in our State of the Social Safety Net series, where we bring together a panel of experts to examine how policy and funding changes to health and human services are impacting the Chicago region. Each of us is experiencing the uncertainty posed by these changes in different ways, with some of our neighbors, our colleagues, maybe even some of us on this call really experiencing significant challenges and trauma. And this conversation is one of the ways that United Way is addressing those uncertainties. We're hoping that this is really good to lift up the work of our partners across the region and share the information that we're learning from them and through 211 Metro Chicago. For today's conversation, we felt it important to focus on what exactly has changed, what may change, and what are the impacts, both potential impacts and actual impacts, being felt across the region and state. So we are honored to welcome three distinguished leaders to provide some additional details and context on the changes and that impact. First, I would love to introduce Grace Hou. Grace is the Deputy Governor for Health and Human Services for Governor J.B. Pritzker. As the Deputy Governor, Grace oversees 12 Health and Human Services cabinet agencies, boards, or commissions whose impact touches every corner of the state. Under her leadership, the Health and Human Services team tackles several critical initiatives, such as implementing the state's plan to eradicate medical debt, coordinate public health approaches to decreasing gun violence, establishing a multi-sector plan on aging, creating a cross-sector justice cabinet, amongst others. Grace, we are honored to have you join us today. Bela Moté is the President and Chief Executive Officer of the Carol Robertson Center for Learning. Bela is an experienced nonprofit executive who has spent her career supporting early childhood and youth development at the local, national, and international levels. Bela is a gubernatorial appointee to the Illinois Early Learning Council, and in 2023, she was appointed by Governor Pritzker to chair the Transition Advisory Committee for the new Illinois Department of Early Childhood, a unified state agency dedicated to early childhood care and education. Thank you, Bela, for all you have done and continue to do on behalf of Chicago area families. And last but certainly not least, Danielle Perry is the Vice President of Policy and Advocacy for the Greater Chicago Food Depository. Prior to joining the Food Depository, Danielle served as head of the foundation and federal initiatives at Capital One Bank and was appointed to serve in the Obama and Pritzker administrations to lead equity-centered work in agriculture. Danielle also served as the executive director for Growing Home, an Inglewood-based workforce development nonprofit that runs Chicago's first and only USDA certified organic farm. Danielle, thank you for your leadership and for joining us this morning. Now, I'd also like to introduce Sean Garrett, United Way of Metro Chicago's President and CEO, who will be the moderator for today's conversation. Under Sean's leadership, United Way has evolved our organizational approach to improving outcomes for individuals and families by ensuring that every person and every family can meet their most immediate basic needs through efforts such as our unrestricted immediate needs impact grants to nonprofit organizations, as well as operation of 211 Metro Chicago. And this work is alongside also helping to transform neighborhoods from the inside out through our place-based initiatives like the neighborhood networks that are designed to provide long-term sustainability and opportunities. Thank you all for being here with us for this very important conversation. I know I'm really looking forward to the discussion. And with that, I'm going to turn it over to Sean to take it away.
Awesome. Thank you, Jackie. And thank you all for being here today. This is the third of these sessions that we have done. And fortunately, they're growing. Unfortunately, growing means that more and more people are concerned about what they're seeing, hearing, and experiencing in community. And so we're grateful that all of you are with us. I also have to say, after hearing Jackie give those introductions, I'm a little intimidated by the people I get to do this interview with. So hopefully I can get out of the way and let them take over from here. As Jackie mentioned, 2-on-1 has become a really important piece of our community. And at United Way, we're really proud to get to operate that, and our team members who every single day answer the calls when people are calling in a time of great need. And unfortunately, more and more people are calling every day. They're calling confused, they're calling frustrated, they're calling challenged. And our team has been there to meet them where they are and get them connected to the resources around the community. But the reality is it's getting harder and harder because as things are changing, people don't know what they're supposed to do. They don't know what the rules are, and they're trying to work through that. And that's a little bit of the conversation that we're going to have today is what's changing? What does it mean? What does it most importantly mean for people in our community? And how can we collectively as the safety net respond? And so with that, I'd love to bring in our Deputy Governor, Grace. We're so grateful to have you here today. And as I said earlier, thank you for everything you're doing as a leader in our state and a leader in our community. We've been grateful to know you for many years, and we couldn't be more proud to have somebody like you leading at this time. Um, First question is, we're all aware, or many of us are at least aware of the new SNAP work requirements, and we'll go through that in more depth. But there's a lot of other impacts that are taking place in healthcare and childcare and housing and other areas. Can you speak from a statewide perspective about how you are breaking down those changes and how they're impacting the local safety net? And how's the state thinking about how they reorganize and collectively address the changes that we're facing before us?
Thanks so much, Sean, and Jackie, and the United Way community. As Sean shared, I feel like we've been partners with United Way for such a long time. And early in my career, when I worked in the social services sector and the nonprofit sector at Chinese American Service League and Chinese Mutual Aid, we were United Way agency. So it runs through my veins, and I'm happy to be here. I would say first and foremost, because I know the United Way community is very diverse and wide, is that, um, I think a lot of this falls on the shoulders of nonprofit organizations, social services organizations, and I think for the most part, many of you are probably aware of the very dramatic shifts that are being made to our social safety net right now. But I think it's also important because I know the United Way community is more than its grantees, but the corporate partners and business partners who rely on social services for their employees, for food, for healthcare, for housing, for childcare, et cetera. This impacts everything. And I think one of the things that is really important to understand as it relates to the social supports for low income and working families is that the funding for these essential programs has always been a blend of federal, state, and very local resources. So when one of us as partners who commit to making sure that these supports are there makes dramatic changes, it creates turbulence for everybody else, right? And so when you look at HR1 or the one big beautiful bill or whatever you call it that the president signed July 4th of last year, they made decisions without considering what the waves will be for us in the state, for businesses, for nonprofits, and for local communities. And so when you think about, right, food, healthcare, housing, childcare, right, those are actually the largest social safety net programs in the state and on the federal side, as well as receiving dramatic funding, like significant funding from the federal government. So what HR1 did in a very dramatic way is really change the backbone of all of these programs for low income and working families. They have really been upended, and I'm not being dramatic. It's what the facts show. You can Google on your own very quickly with reputable national sources as it relates to what food insecurity will look like as it relates to the changes to SNAP, healthcare coverage through the changes that impact Medicaid as well as ACA, the proposed HUD changes to individuals who need support with housing and then the childcare issue that has been in the headlines, right, since the beginning of this calendar year. So really, really briefly, and I could speak for hours on this because these are not, the rhetoric is simple when you talk about work requirements or having people, earn their benefits, that rhetoric is easy, but really understanding the impact and what states and people are going to have to do to respond to it is super complicated. And so the thing that, in the event that you don't have to live this on a daily basis, I would just invite you to look beyond the headlines and really understand, what the challenges that people go through in order to receive SNAP, right? SNAP is not the solution to food hunger and food insecurity, but it is the most significant solution to hunger and food insecurity. So in Illinois, there are about 2 million individuals who receive the SNAP benefit. Because of the changes to HR 1, there's a projected 500,000 individuals who may lose coverage as a result of that. We are doing our best to work with the food depository and community-based organizations to shore up and mitigate that harm. I think that's one information point, and we are already making progress in that regard. The other piece is that the potential wage losses associated with that is $1 billion. I think the other piece outside of food insecurity is that SNAP is one of the highest economic, magnifiers in communities. And there's a threat of $7.2 billion in positive impact as a result of these changes. So that's SNAP. As it relates to impact on healthcare, Medicaid insures 3.6 million Illinoisans who are on Medicaid. There's an additional almost 1 million people who are the ACA population. So as it relates to the first population beginning in January, they are going to have to jump over more barriers, more hoops, provide more information, and we need to increase bureaucracy for them to retain their health insurance coverage. Like, we're talking about health insurance. The other piece, which has already kicked in, is the 700,000 individuals who are on ACA, right? Their premiums are already increasing. So the increased subsidies have waned. And so individuals will see an increase in their monthly premium payments for health insurance of between $260 to $500 a month, which is about an 80% increase. So some individuals will not be able to afford the premium increases, and it's estimated between 70 and 90,000 people will lose health insurance coverage. Who does that work for? For individuals who will no longer be able to seek preventative care and will end up in the emergency rooms. It does not save anybody anything. I mentioned at the beginning that there were dramatic changes proposed by HUD, the U.S. Department of Housing and Urban Development, to make dramatic changes to its program model, moving away from permanent supportive housing and towards transitional housing. And that can upend literally individuals who are sitting in homes right now who get support from HUD. Thankfully, there was a lawsuit and action by Congress, and HUD was unable to make the changes for this fiscal year. However, HUD is able to release funding for a new program model in the spring. And Sean had mentioned, I think, the increase in calls to 211, and we were talking to our chief homelessness officer earlier this week, and I learned that one of the highest reasons for folks to call 211 is because of housing instability, and that will only increase in the months to come. So I'll end by talking about the child care program. On January 6th, there was a federal funding freeze that literally came out of nowhere on the Federal Child Care Development Fund, the TANF block grant, and Social Services block grant. Those are a lot of words to basically say there was $1 billion that was put in jeopardy to fuel the child care assistance program in Illinois that enables 100,000 families to get to work as well as to study, so that 152,000 children in Illinois on a monthly basis can have quality childcare. Fortunately, the Illinois Attorney General's office and other AGs from other impacted states leaped into action, and there was a TRO and now federal action. So there's a stay on that decision. And so I think the second part of your question was, and I know we'll talk a lot more about it, is what we are doing. We're working really closely with the Attorney General's office, community-based partners, subject matter experts. Like we're firing on all pistons, from increased staff, modest increase to administrative funding to the extent that we can, because we cannot take on the responsibility of the federal government, and really have an all-out effort to mitigate the harm of HR1. I'll stop there.
Deputy Governor, thank you. And thank you for everything you and your team and the governor and others are doing. We're very grateful. I'm going to turn our conversation local for a moment. And with Danielle and Bela, I'll bring you in. And Danielle, maybe I'll start with you to speak a little bit. The Deputy Governor talked about already some of the impacts around SNAP and some of the changes. So can you talk a little bit more about the impact the SNAP requirement changes will have specifically here in Cook County and on our local economy? And maybe a little bit about what you're hearing from food pantries, from the communities being impacted, what you're hearing from residents, and how you all are responding.
Thanks, Sean. And the Deputy Governor did an amazing job explaining the cuts to SNAP and what's at stake in this moment. From a perspective of the most immediate thing, like the Deputy Governor said, there are a number of cuts that are coming, but SNAP is the one that we are going to feel and see in the coming days. So, if you know a little bit about SNAP, you've always had to work to receive this benefit. What the Big Beautiful Bill did, it just changed the work reporting requirement, which, like the Deputy Governor said, is just another hurdle, more barriers, more red tape, more bureaucracy. That's not just being put on the individual, but even the state itself. And so now people are going to have to be able to show and prove that they're working 80 hours a month or volunteering 80 hours a month or participating in a SNAP employment or training approved program to keep their benefit. And what we're going to see is, one, whether people even know that these changes are coming. So we're doing a lot of outreach. This moment right now is an outreach moment, sharing and spreading the word that these changes have happened. But two, helping people navigate those changes, keeping them enrolled in the program. We're hoping that everyone who could be exempted from this work reporting requirement completes an exemption form. The food depository, you could literally call our number today. We can help you navigate that employment program, that exemption form. And there are people all across our state who do that same work of helping people apply, but also staying enrolled. Because what's at stake is, like the Deputy Governor said, 500,000 people could lose their benefits as early as May 1st. And that in Cook County alone looks like 100,000 people losing their benefit at once. We've never seen that drastic of a loss at the same time in our system. So what happens next? What does that look like for us as a community? That means those people could likely end up in the pantry line at our food pantries or the soup kitchens, shelters. But it also has an impact beyond the individual that I want to make a point about, Sean. We often think that, let's say that mom who loses her benefit, that it just impacts her. But she's in part of a household that we need to acknowledge. She was already with her SNAP benefit, struggling to put food on the table for her family. And now with the loss of her benefit, that household benefit now decreases. So that's kids going to school without meals. That's the senior, the elder that lives in her house, maybe not having the food they need to eat. But it also impacts our entire community. And I think that's important to note. Some people hear us and think, I don't receive SNAP, so what does this matter? But $4.7 billion comes from the federal government into our state every single year. Where does that money go? To the grocery store, to the farmer's market, to the local corner store, that small mom and pop business. What does that business do when they lose that revenue? They let go of some of the staff. They increase prices on the rest of us. And in some communities, the communities where we likely have been begging for grocery stores to come, they may close altogether. So the impact is felt well beyond the immediate person, but it's their family, the grocer, the retailer, and our whole community. And just to leave you with one point about what this looks like for the pantry, people sometimes will just think, okay, well, everybody can go to the pantry and we can make up for the loss of SNAP. But for every meal we provide in the emergency food system, SNAP provides 9. We can't make up for the loss of SNAP at a pantry. We just can't. And when you look at just the period of time during the government shutdown in November, in the week before, the last week in October, and the 3 weeks that it was shut down, the food depository saw 250,000 households come to our pantries. That's more than we've ever seen in our history, more than COVID. And that tells you a lot. We also saw that 50% of those people were new people coming to the pantries. We saw an increase of new people by 50%. So what does that say? What does that trigger for us? It lets you know the power of this program, that during that just 4-week period where they shut it down, we saw so many new families coming for the first time, means that the SNAP benefit was making it so that they never had to come. And so what happens when 500,000 people could likely lose their benefit on May 1st? What happens when next year we could lose this program and all 2 million people lose the benefit? The pantry system can't make up for it. We will be inundated with people and we will struggle to be able to provide food, and people may go hungry.
Thank you. I mean, it's sobering, but it's also helpful to think about it both at the individual level as well as the community and ecosystem level, and the impacts are reaching. I'll tell you, one of the things we saw during that exact same period at 211 that was telling and also really scary was we saw enormous increases, 140% increase in 211 calls in 1 month, and then another 140% increase in 211 calls the next month, mostly for food. We actually saw a drop in housing calls. And what we found is that people were focused on getting their food because that was the most immediate need. They were like, we'll figure out housing later. We've subsequently seen a significant increase in housing calls. And it's these things are all related. And as you said, you think about the one family, but it has an impact all around beyond that individual. So thank you for sharing that. Bela, we want to turn over to you. And I mean, first of all, you have so many great things going on. And so I know we're going to focus on some of the challenges, but I do want to highlight that, Bela and her team have a very exciting week ahead of them. And so feel free to share with folks on that front. But you're dealing with real challenges and your families are dealing with challenges as it looks at changes in the childhood development and early childhood work. Can you talk a little bit about how that impacts you all and how it impacts the families that you serve? What are you hearing and what are you doing about it?
Sure. Sean, thank you so much for bringing us in community together. I think these conversations are so important, and it actually removes a little bit of the isolation factor. And Deputy Governor, thank you always for being a partner. Danielle, the stats are sobering. So I'm learning something in this space together as well. So what I'd like to do is kind of take us very hyper local and then bring it back up. So Carol Robertson Center, as folks know, is an early childhood and youth development organization. We serve directly about 2,500 children, prenatal to 18 every single day. And then we reach about 15,000 children and families across the state. And as Grace shared, we are a public good. We consider ourselves a public good, much like K through 12 education. What that means for us is that we patch together various types of public funding sources, right? That includes funding, Head Start and early Head Start funding that comes directly from the federal government to Carol Robertson Center. And then we have a state that is a champion of young children and their families. And so we receive state dollars, which includes our state pre-K program, as well as childcare dollars. And we heard Grace talk about that funding freeze, which I'll talk about the impacts of that. And then we raise local dollars, right? Whether it's from the city of Chicago or private dollars from corporate and foundation partners. And so all of that allows us to fuel high quality, impactful programs for children and for families in some of the most under-resourced communities in the city of Chicago.
Last January, soon after the inauguration, there was the threat of Head Start, an act of Congress. Head Start is passed by Congress. It has been just a loved program, a beloved program for 60 years in our nation, right? Who believes that the brain science tells us that children who are 5 and under actually need high quality early care and education. That was proposed to be eliminated. There are about 1 million children across the country who receive early Head Start and Head Start funding. What does that mean for an organization like Carol Robertson Center for Learning? That means that that base funding would have been eliminated. And so the reliance for us on state, city, and private dollars dramatically goes up, right? So that was at risk. And thankfully, through mobilization and advocacy and really uplifting the voices of children and parents and community members, it was preserved for now. The other thing that I would say is, along with the possibility of the elimination of Head Start, we also had a lot of executive orders that were coming down our way. Many of them affected the sort of the way that we respond and serve our children and families. So the anti-DEI orders really affected the organization's ability to kind of ensure inclusivity, belonging, making sure that we were right there. And then the third was the presence of ICE in our communities. We have many, our city is beautiful because we have families from all over the world. And with the ICE presence increasing, that also affected our ability to respond and serve. So that's just the federal landscape and the shifts and sort of the turbulence that we were seeing. And I want to really piggyback on what our deputy governor shared. It is not in isolation, right? Our families, their ability to access Head Start services, come to Carol Robertson Center and then access SNAP benefits, it's intertwined. And so while we're trying to keep up with all of the flurry and the chaos coming our way, we're also learning how to be much more responsive than we've ever had to be around housing questions that are coming up, food questions that are coming up, and really becoming that sort of sole source to play that runway or air traffic controller. In terms of the child care funding freeze, right, while Head Start was preserved and we caught our breath for just a little bit, come this January, all of a sudden there's a child care freeze. Again, what does that mean for our children and our families on the ground, and how do we respond to the unknowns, starts to become an administrative burden. The things that we do, which is to be responsive to our children and families, to have those authentic, high quality experiences, we're distracted because we have to figure out what we have to respond to. And I think that has really created a couple of things. One, it's really strengthened, and Sean, I think you shared this a little bit earlier, the need for accurate information. We see ourselves as sort of that broker and conveyor of accurate information. We also have really seen the opportunity to tell, in partnership with folks here together and then community-based organizations, the stories of the lived experiences, and then really focusing on these situations where families are fearing to go to a food pantry or bring their child to school, or to make sure that they're seeking the medical services that they need because they're afraid to leave their homes. So how do we partner more effectively to make sure that those gaps that become a reality don't persist too long in the changing tide that we continue to sort of work together. And then one piece that I will just say is that all of these things, these are working families. There are eligibility requirements for childcare, there are eligibility requirements for Head Start. And so as we think about the city of Chicago and the state of Illinois, when you remove one piece of the Jenga, tower, it really does have a compounded effect on everything. And so that does affect the employers, not just Carol Robertson Center, not just the food pantry, not just the state of Illinois, Illinois, but local businesses, right? Local folks who are doing what they want to ensure becomes sort of the social safety net in much broader ways. And I think sometimes we think about these headlines in isolation, and they start really with sort of the impact of the community and work our way backward to that one child or that one family.
Thank you, Bella. And you could not have set up the next question any better. So thank you for continuing to make my job in this easy. Grace, one of the themes throughout this conversation, and Bella just really stated it, has been the interconnectedness of these issues. And so when a change is made in one policy, while the headline might be about the policy and the impact that it has on that particular issue, it actually impacts so many other things. And in your role, you have responsibility for a number of cabinet level departments, boards, and other interconnected organizations. And so can you talk a little bit about how you and the state agencies are working together to address the ripple effects that are happening across the broader health and human services with these individual changes that just have enormous impacts on the ecosystem as a whole?
Yeah, thank you for that question. I mean, I think first and foremost, it's really important for us to see the health and human services system as a system rather than individual departments and what their programs are responsible for. And that is obviously actually easier to say than to do in many respects. And I would say, you know, my role in particular with our team in the governor's office, I see my primary role is to break down the barriers in between agencies and to the greatest extent possible, enable community members and recipients of these programs to have it, as fluid as possible experience between these programs. And I think what we described, or what I described earlier, is that these barriers are actually going to actually increase and move in the other direction. For many, many years, red tape was a bad word, right, in government. And it's something that we as government officials were always trying to overcome. Pressures from, I would say, national as well as local legislative leaders has always been cut the red tape. Well, we're increasing red tape by design and by requirements as it relates to what our federal funding partners are now requiring. And to talk about the interconnectedness of these programs, 90% of people who are on SNAP are also on Medicaid. And then 50% of individuals who are on Medicaid are also on SNAP. So, and individuals who receive SNAP and Medicaid as well as the TANF program go to Department of Human Services local offices. And so if you're an individual who is working and or going to school and have a family and a busy schedule, you are now contending with more rules for both of these programs that we're talking about. I think the impact is not only on the recipient, as we talked about. I think Danielle was very, clear around the impact on the local economy as well as grocers. But let's also think about the healthcare system, hospitals, free and charitable clinics, FQHCs. We're going to be seeing an increased number of individuals who have insurance of no kind, right, because of the changes. I think the changes as was introduced by HR 1 is not only about who is eligible for Medicaid any longer in terms of what they need to do to become eligible, because work requirements will also be a factor for a significant amount of publicly insured individuals. And this is very, very weedy. The way that different hospital and provider taxes is calculated now on the federal level will also mean that the state of Illinois will lose potentially $50 billion over the next 10 years of federal investments into our healthcare system. So if you think about any industry or any sector who will be approaching a $50 billion decrease in funding over the next 10 years, things are not going to be as they were before, right? With a greater number of people who are uninsured and a disinvestment in our healthcare system. So it's you don't have to be a subject matter expert in healthcare funding to understand that that is going to be very disruptive, not only for individuals who are seeking healthcare, but for providers, hospitals, and healthcare systems. So what are we doing about it? I think it's important to say first, the state can't solve this problem. We just simply can't. And we talk about all of the disinvestments from the federal government. They are pulling away from the table with funding. And that, you know, we have always been a partner, not just for human services, but for a array of other governmental services as well. So folks cannot look at the state and say, okay, well, you're going to have to plug this hole. It's just simply the math does not work. And so our goal is not to solve the problem, because we can't solve the problems that the federal government creates holistically. But what we can do is we can mitigate the problems, mitigate people falling off SNAP and people falling off Medicaid. So what we've already know is that we're not going to prevent people from losing their coverage, but we're going to try to decrease the impact to the greatest extent possible. And we're doing that through policy changes that will, in some instances, increase red tape, and hopefully in some instances, using technology, right, to create more efficiencies and make our process smarter. I think Danielle and Bela talked about this as well, is we need everybody to communicate the changes to your customers, because they need to respond to notices that are coming from the Department of Human Services and from Healthcare and Family Services, and soon the Department of Early Childhood, right? Because there are a lot of boxes to check now, and non-responsiveness will mean that you will fall off the program. So communications, communications, communications. We are also having to make investments. The state is now bearing additional costs, not just to run the SNAP program, but now we have to hire hundreds of new caseworkers to deal with this additional red tape. I would say also, as part of our strategy to mitigate the harm, is that we are building a process to work really closely with our community-based partners. We know oftentimes the credible messengers are not state workers, but they're folks from the food depository, from the pantry, from our child care centers, et cetera. And so we've been having conversations with philanthropy as well as our community-based partners to figure out what that looks like. The other program that I wanted to lift up as it relates to playing our part as a state is our medical debt program. Through this innovative program that Illinois is one of the pioneers of, we have eradicated $1.1 billion of medical debt for more than 500,000 Illinoisans, with an investment of $10 million of state funding. So for those individuals who have been bearing, you know, this debt and carrying it and paying whatever amount they were able, if they're 400% or below the federal poverty level, or those with medical debt with 5% more of their household income, we've been able to mitigate it. We've worked closely with philanthropy as it relates to the Reproductive Health Justice and Access Fund. We know that the federal government is very much wanting to disinvest in any providers that provide gender affirming care for adolescents. So we've established the Prairie State Access Fund in partnership, or the Michael Reese Health Trust has established the Prairie State Access Fund. And then finally, the Department of Healthcare and Family Services applied for and received funding from the federal government through the Rural Health Transformation Program, $193 million to invest in the rural healthcare system. So long story short is we have to do a little bit of everything to respond and mitigate and to ensure to the greatest extent possible people in Illinois are able to rely on critical safety net programs.
Thank you. And thank you for everything you and your team are doing. We're really grateful and appreciative. So I'm going to take us to our last question, but I know we've got a number of questions that are coming in the chat, and Danielle is like a superstar. She's like answering questions in the chat and online. I'm very impressed, Danielle. Well done. But encourage folks to use the Q&A feature, because we will, after this question, open it up to questions from all of you, and that will allow us to work through this. So take your time now to enter those questions. And I'll start with Bela and Danielle. I mean, we've heard a lot about how the ecosystem is being impacted. We've heard a lot about individual organizations. We've heard a lot from Deputy Governor about the incredible work she and the state are leading. What can folks on this call do? How can employers, how can funders, how can community leaders, like, what should we be doing right now? Obviously we always want financial support, so I'll just say that for you. Everyone should give as much as they can, and that makes a lot of things better. But in addition to that, what should the people on this call be thinking about, and how can they be part of the solution? And Bela, we'll start with you and then go to Danielle, and then Deputy Governor will end that question with you.
Well, one, I want to just give Danielle a shout out because you're a multitasker. I must learn from you. Great question, Sean. I think one, I would just encourage United Way to continue to have these conversations. I think it allows for folks to hear the different perspectives and also share our commonalities, right? I would say that for folks who are on this call and beyond to be, I think, Sean, you said this word and I really like it, the amplifiers. And then to also encourage employers to talk to their employees. I think there is such benefit to hear the lived experiences of what is happening. For my nonprofit community, I think there are so many lessons that we've learned from the pandemic. And Grace, I'm just harkening back to during COVID times, how many times you and I were on a call together, right? And I think that we are rebuilding that muscle. That is not too old. It's just about 5 or 6 years old during these times. And what I would say is the need for ongoing accurate communication. And I think Grace is absolutely right that the stewards of that communication have to be those that community members trust. And what I would say is that as civic partners engaged in civic conversations about the state of our country right now, we cannot forget the importance of elections and ensuring that people go out to vote. So whatever we can do to ensure that those that we serve and partner with feel that they have power to make change, I think is really important always, but especially now. Danielle, I'll let you chime in too.
All right. Well, I agree with everything Bela said. Second, so internally, the food depository, we've started something we're calling Operation Save Our SNAP, and it has 5 different levers, but I'm going to point out 3 that show you where you can plug in and engage and do this with us. So to repeat, Bela, the first one is building awareness, spreading the word, getting everybody who's on this benefit to know what is happening, to know what the changes are and know what they need to do to stay enrolled in this program. So we need you to help us. I just want to lift up some of the partners, like, again, what United Way is doing in this moment, offering a public space to spread the word. So if you can think of ways that you can do that in your own community, whether it's us talk about it with your staff or us come to your community, we could do it as a partner. We can come together. We can use the food depository as a space. Whatever you want to do for us to spread that word, we have created a toolkit. And we have 2 versions of it. We have one with the Greater Chicago Food Depository branding, and then we have one with what we're calling Save Our SNAP branding. You can use that statewide. I'm going to share the link to the toolkit. It has one-pagers, posters, flyers, even words that you could add to a newsletter, Instagram and Facebook, Twitter, and TikTok posts. You don't have to do a thing. We did it for you. So I will share that in the chat. That's building awareness. And we can do that together. One person I'll shout out is the city of Chicago. You know, when you're driving down the expressway and you see those billboards where they tell you to put your water on when it's cold, they're going to start leveraging those public spaces to just post and say, SNAP changes are coming. check with the state, update your information. But that's just an example of the fact that businesses, nonprofits, we own space where we could talk about this. Even the grocery store is doing it. Grocery TV is going to just put up a thing when you're at the checkout counter that just says, use this QR code, update your info. And that's what businesses can think about doing as a partner. The second is benefit enrollment. We are creating a network of benefit enrollers across the state where we're training, making sure they have all the information they need, and supporting each other so we can be enrolling. If you think back to the days of the Affordable Care Act, how they had navigators everywhere, we want to create a movement like that where there are enrollers everywhere and they have everything they need to make sure people stay in the program. If you are interested in learning how to become an enroller, if you want to be trained because you already enroll, or if you want to just host, the Food Depository will send somebody out to help people. And if you have clients who need help, you can call our number today and get help immediately. And then the last thing is we need to create a movement. We need advocates, people who are fighting to save this program and lift their voice. We have our own advocacy center here at the Food Depository. You can join our team. It's as easy as just sometimes sending an action alert to your state rep or your state senator, or actually coming and learning how to go and advocate and knock doors, go to Springfield, do what we have to do for fight for this program. So build awareness. Become an enroller or support enrollment and advocate today. Those are your 3 takeaways. I'll put your homework in the chat.
I can't say it any better than Danielle and Bella, so I will say ditto. And just add one maybe exclamation point is that I think the changes, most of the changes that we were talking about are decisions that have come from the federal government. And so that last call to action, I think copy and paste for folks who are or part of the decision making that led to the passage of the big beautiful bill.
I'm pretty fired up, so thank you all for that. That's great. So let's go. We've got time for maybe 1 or 2 questions. So I'm going to pull up the questions from the audience, and thank you all for sending these in. And apologize if we can't answer the questions here. We will answer them as part of the follow-up, and we'll get back to you. And so we've got a number of questions in here, and so I apologize that I'm just probably going to just work through these as quickly as we can, but there's a few questions I would say maybe around, and Danielle, you've been answering this in the chat, but around the Serve Illinois website, how to be connected to it, how it can be support, what does it take for a nonprofit to be able to be a part of that? Danielle, can you maybe talk a little bit to the extent you have, because you've been answering a lot of questions there, but just a little bit more about the volunteer capacity and the role within the work verification and how folks can be connected to what's being done at Serve Illinois and that as a potential answer?
I just knew you were going to say Deputy Governor, because Serve Illinois is the state thing.
You were starting to answer,
I'm happy
so I
to
figured you
just
had
say
the answers.
the Food Depository, the state, first of all, let's say the state showing up in this moment and creating a seamless website where both the organizations and community can come and put volunteer opportunities up, and that a SNAP user in real time can find those volunteer opportunities, and we could actually go in the system and then certify that they did it, and it goes directly back to the state, is a literal example of what the Deputy Governor and her team is doing to save people and mitigate harm. When she said we can't fix the whole program, but we can mitigate harm, this is an example of them doing just that. So we're going to use the Food Depository example. We are going to put our volunteer opportunities on the Serve Illinois Galaxy website. And then anybody who receives SNAP could go in and sign up to come volunteer. Once they volunteer, it'll internally send a message to us. We can certify that they did it, and then they know that they're meeting, their hours. And so I just would say, as a call out to the people on this phone who are watching us today, go on to Serve Illinois, enter your volunteer opportunities. Even if you don't have one right now, go ahead and register. We're going to be hosting at the Food Depository 2 sessions where people can learn more and get some support signing on to the program. If I can get the link, I'll put it in the chat before we end this so you can sign up to get some help. But Deputy Governor, if you have anything more you want to share about this, I did want to just say thank you for what you're doing to make it seamless for people. We don't want to see people volunteering to eat, but if this is what they have to do to stay in the program, we want to make sure we're providing the opportunity.
Yeah, I mean, I would say it's such a pleasure to work with our community-based organizations and the leadership of Danielle and Bela. I mean, this is how government should work, right? We do work in a very proactive way, but now we're working in coordination in a responsive and reactive way, unfortunately. You know, I said early on that state government cannot solve all the problems and government cannot solve all the problems. We have a huge role to play, but we need to do that in cooperation with our community-based partners. What I would add is that Serve Illinois is part of the Illinois Department of Human Services. There is an independent board of commissioners that oversees that program, but I know that the department is actively trying to figure out how it can connect the Serve Illinois infrastructure into this work requirements ecosystem as well.
That's great. And we will, Danielle and Deputy Governor will work with you all to get all the information and links out, and we'll make sure that everyone who's registered for this has access to that. So folks who are interested in that information, we'll make sure that we send it to everybody so that we can make sure we populate it. So one last question, just so we have a very limited amount of time, but there is a question on the role of mutual aid groups and how they can be helpful in this time and how we work with them. And I will tell you from the early days of COVID, it was really amazing to see how they kind of sprung into action and some of the work that they were doing. And I remember Deputy Governor working with you in a different role actually around that at the time. And so would love just any of you who want to comment on kind of the role of mutual aid and really other organizations that are part of this ecosystem that are maybe non-traditional in some ways, but are now really a core part of how our community is responding.
Yeah, I'll jump in really quick first. I mean, so I think as I shared and as you just mentioned, Sean, I used to be the executive director of Chinese Mutual Aid Association, and Chinese Mutual Aid, which is located in Uptown, was established by individuals who were the first to arrive from Vietnam, who are ethnic Chinese. Who were resettled in large part in support by folks from the Jewish Federation. And from there, they established an organization to then begin to serve other new arrivals. And we've seen that replicated over and over again, not just obviously in the Asian American community, but in immigrant and refugee communities across, right, the globe, I would say. We also have very strong faith-based organizations in Illinois and across the country. We have United Ways. I wanted to lift up a couple of things for recent examples and the importance of that with philanthropy as well, which is in response to Operation Midway Blitz, the federal enforcement action in Chicago and parts of Illinois. Individuals did not feel safe going to work. Individuals did not feel safe having their children walk to school, et cetera, and so forth. And so amazing mutual assistance organizations in cooperation with philanthropy and through donations from community members established walking patrols for students to get to school, established funds for individuals to put food on their table because they were losing income. They didn't feel comfortable going to the grocery store. You saw a lot of unity in that. And so that it was obviously unfortunate that needed to happen, but there is this beautiful way that community organizations and community groups come to the rescue, right, for individuals and families. That is hyper local, and that is something that government will really never be able to do and replicate. And so the community based ecosystem, individuals who are standing up in their own way to contribute is so very vital.
Can I just add, the city of Chicago gave us $500,000 to give grants to mutual aid organizations who are doing food delivery and support of food in community, like the organization that Deputy Governor just lifted up. And we did get those grants out in the last couple of weeks. So we saw that amount of money go out to mutual aid. And that's a partnership that's new for the food depository, but that we want to continue to grow. And then lastly, I'll point out, the Deputy Governor made a great point that, private philanthropy, support of business is helpful to this work too. We are going to be lifting up a new program at the Food Depository that's a direct cash assistance program on around May 1st, when people lose their benefits because of the work requirements. We know that pantries can't do it all. So we've been supported by private philanthropy and some businesses to stand up a cash assistance, direct assistance program to people. It'll probably be about the amount of a couple months of their SNAP, but it will give them a chance to regain access to the SNAP program. In those couple of months of cash assistance, they'll be able to figure out how to get the volunteer opportunity or to find the job. And we're also advocating that the state legislature pass a bill to do a direct assistance program for 3 months worth of their SNAP after they lose their benefits in May. So we know that a partnership between business, philanthropy, government, that we'll be able to answer this collectively, but we have to also get creative and think of new partnerships like mutual aid or even direct cash assistance programs, which we know are very impactful.
And I would just, I want to end with just a silver lining. I think what we're hearing is that this gives us an opportunity to work with individuals and organizations that we typically don't work with. And what I would say is that while we're in a reactive state right now, the goal is, how do you maintain and preserve these partnerships so that we're ready for the next wave of uncertainty and we have a bigger tent in which we work together?
This is great. I can't say thank you enough. And I will say that meetings like this are where it's a reminder that we are very lucky to be where we are, to have the type of leaders like the three of you who are driving this kind of response. And frankly, not response, you're driving how do we as a community move forward? And that's something that I'm really grateful and proud to be a part of and get to work with all of you. So thank you. And thank you for all of you for joining us today. I mean, part of what we need to do is to share this information. And, I'm glad so many people were here today. We need you to be part of this conversation. And you've had a number of call to actions. There's a question that I saw earlier that said, can we continue this conversation? Yes, this is the third one we'll do. We'll keep doing this as long as they're valuable to people. And so we're more than happy. I would like to do it when we celebrate all the amazing things we're doing, as opposed to dealing with the challenges we have, but we're going to keep doing it regardless. And we're grateful for all of you. I'll highlight on April 22nd, United Way has our annual April Food Day in the South Suburbs. We'd love for all of you to join us and be a part of that. We will commit to getting out all the information that was shared today. We'll work with our speakers to make sure we have the right links and information so that folks can get connected in real time in the work that's taking place, because all of us have a role. We're grateful that all of you are here with us this morning, and we're excited to continue this work together. And so to our Deputy Governor Grace, to Danielle, and to Bela, thank you for everything you do. We're grateful to have you and looking forward to continue the work together. Thanks, everybody.
Thank you.